Today I'm going to introduce the use of topical medications for pain. Topical meaning that the medications are applied directly to the skin. Why? Well, topical medicines actually work. I was somewhat of a disbeliever in the past, but it's actually true that topical medications do work. For those who are not on opioids, they may actually provide enough benefit to avoid the need for opioids. For those who are on opioids, it's not likely the use of topical medications will provoke you to get off your opioids in and of themselves, but they will help reduce your reliance on opioids. But the truth is they actually work. And for the most part, they can be affordable. They're readily available. So I think it's time that people with pain, both acute and chronic, become familiar with the different topical medications available. These medications may be available by prescription, which includes the use of compounded medications that are prescribed by a physician, but compounded and produced by a pharmacist in a custom fashion. And over-the-counter topical medications are very available, although the over-the-counter world of topical medications is in a bit of a quagmire, and we'll get to that in a later conversation. Topical medications are generally, the term topical is generally reserved for something that is used on the skin to promote a local or regional effect, but technically topical medications fall into two categories. There are transdermal topical medications and just plain topical medications. The distinction is that transdermal medications are formulated to penetrate the skin deeply. The idea is that a transdermal medication will penetrate to the deeper tissues, which will allow it to enter into the bloodstream. This then allows the medication to be transported systemically, so it not only enters the skin, but it also enters muscle, bone, even organs, and the brain and nervous system, most importantly. The use of transdermal medications is most commonly thought of in terms of butrans and fentanyl patches. These are patches designed to provide pain control over the span of days through a prolonged release through the skin. Transdermals offer a variety of benefits. They avoid the need for the medication to go through the GI tract and through the liver before getting to the blood. That allows the medication to get to the bloodstream before it's broken down significantly in the liver, which is the case with both buprenorphine, which is in butrans patches, as well as fentanyl. These medications, when taken orally, will be so severely metabolized after oral ingestion that they don't even get to significant concentrations for pain management anyway, by the time they get to the bloodstream. Topical medications, back up one last thing, the benefits of transdermal medications is their systemic access. However, that comes with the other side of that coin, which is the transdermal medications are also accompanied by systemic side effects. So they aren't perfect means of using medications. Topical medications, on the other hand, are actually formulated to penetrate only into the regional area. So the topical medications are applied over the area of pain. May that pain be muscle or joint or an extremity. Topical medications do not penetrate significantly into the blood and therefore are not associated with the side effects one might see with the medications when taken orally. They have that distinct advantage, and in some cases they actually can access nerve fibers, for example, in the skin that oral use of a medication can fail to get to. So, for example, I've had patients who are on high-dose gabapentin, but still, despite that, when provided with a topical compounded form of gabapentin, they actually still achieve even further benefit. The other advantage, of course, is for those people who don't tolerate an oral version of a medication, again, such as gabapentin, but they can benefit through the topical use when they don't tolerate oral use. The side effects that can occur with topicals, however, does include rash or itching, and these are not entirely uncommon, but not serious. So, in order to break down the conversation of what topical medications should use for what condition, I've grossly broken it down into muscles, joints, and nerves, or neuropathy, for example. It's a broad sense of categorization, but useful, and we will get to that. In this particular series on the use of topical medications, a separate video will be presented for the use of topical medications on muscles, another on the use of topical medications for joints, and a third one for the use of topical medications for nerve pain and neuropathy. In addition, I'm going to develop some videos specifically directed at prescription medications, including topical medications, as well as over-the-counter medications, and a third and separate breakdown in medications will focus on cannabinoids, including CBD, BCP, and THC, and we'll get to those in future videos. Now, when making a decision as to which topical medication one is going to use on a particularly painful body part, it would be important to consider the category of pain or the type of pain that you're treating. Now, there's so many different ways of distinguishing one type of pain from another, but for the purposes of this conversation, the breakdown of categories is going to include the pain associated with tissue damage, inflammation, nerve damage, or nerve dysfunction. We will also look at referred pain, in which the pain source is located in one location, but the perception of pain is perceived in a different location. And finally, it's important to consider the concept of sensitization when choosing a pain medication to apply topically. So, starting with tissue damage. Tissue damage can be acute. For example, muscle pain that is injured from overuse or trauma. This type of tissue damage is associated with the triggering of multiple types of nerve receptors, and the character of the pain that one perceives which could be perceived as hot or even cold, burning, dull, aching, sharp. These characteristics of pain will help the physician distinguish the natures of the tissues involved that are provoking the pain. Trauma does induce a variety of factors that contribute to the pain. Part of the acute traumatic injury includes the body's normal physiological response to that trauma, and this includes inflammation. Inflammation may be perceived or identified by the presence of redness, swelling, and it too can contribute to pain, unfortunately. So when one is continuing to perceive pain in an area of trauma, you may wish to not only use a non-specific analgesic formulation, but also one directed at inflammation. Clearly, tissue damage can also trigger various nerve receptors and trigger nerve pain as well, which may be perceived as burning or electric, sometimes sharp or stabbing. Another category of pain is inflammation that we mentioned. Inflammation, again, characterized often by redness, warmth, and swelling. While particularly associated with acute pain conditions, it's also associated with chronic conditions, pain conditions that are diagnoses associated with itis, I-T-I-S, at the end of the word, such as arthritis, bursitis, tendinitis. These are all diagnoses that are based in an inflammatory condition, and as such, medications applied topically to reduce inflammation will often in turn be effective in reducing pain. We'll get into the different types of anti-inflammatory medications, but there are many. Nerve damage and nerve dysfunction is another reason for a tissue to evoke pain. Nerve pain, as I mentioned, is generally perceived to be burning or electric shock-like, sometimes sharp or stabbing. In addition, it can often be perceived as even a tingling, like your hand is falling asleep, or a prickly sensation. While these symptoms are sometimes overlooked as being painful, they are in fact unpleasant and therefore meet the definition of pain. Clearly, we want to address nerve pain with medications more specifically directed at the function of nerves in a way to suppress that pain. Most often, anti-inflammatory medications aren't particularly helpful for nerve pain. This applies both orally and topically. There's another concept of pain that needs to be considered when evaluating the potential benefit of using topical medications for pain, and that is the concept of referred pain. A referred pain is one in which the source of pain is in one location, but the person's perception of pain is actually in a distant source, a distant location from the source. The common example of this is sciatica. Sciatica is typically a pain perceived as being generated in the spine, either the neck or the back, and then radiating down to the hand or to the leg. Sciatica being in the leg, often down as far as the foot. Applying a topical medication in the area where the pain is perceived would not be successful if you're counting on that. Sciatic pain, for example, down to the foot, is sourced in typically the in the lumbar spine. So applying a topical medication in the area of pain in the leg or foot is not likely to offer any benefit. Also, another type of referred pain, which is unfortunately often overlooked by patients and physicians, and those are the referred pain associated with trigger points. Trigger points are areas in muscle that are associated with usually chronic neck pain, chronic back pain, but they're areas in muscle that become sources of independent pain. A trigger point can be described as a localized area in the muscle in which the muscle fibers become adhered to one another and inflamed. They can be palpated as a tense area in muscle, and they are painful when someone pushes on them. They're painful when the muscle is stretched, and most importantly to remember is that they are also a source of referred pain. I can't tell you how many times I have had patients diagnosed and treated for sciatica as if it were sourced in a pinched nerve in the lower lumbar spine, whereas in fact the source of the referred pain was actually in muscle fibers in the paraspinous muscles in the lower back. So it's important to consider whether or not you're experiencing referred pain before you decide to apply a topical medication to it. Finally, there's one more factor that's important with understanding how to treat pain with a topical medication. That is something called sensitization. Sensitization is a process in which the nervous system becomes sensitized in so far as the perception of pain and other sensory experiences become magnified and disproportionate oftentimes. They are a consequence usually of chronic pain, but are manifest by an exaggerated response to pain when a painful stimulus is applied. This is called hyperalgesia. When a normally painful stimulation is perceived in much greater magnitude than should be expected. There's another manifestation as well, which is something called allodynia, and that's when a stimulation which should not be perceived as painful, in fact, becomes painful. This might be something like the brushing of sheets against your legs while you're in bed, and those sheets are very unpleasant when they do that. Even breezes across the face can be unpleasant or painful. And these are sensory perceptions that shouldn't be painful, but become so due to sensitization. Sensitization can occur in the peripheral nervous system in the extremities, or in the central nervous system where it's most commonly identified. The consideration of sensitization is important when you're dealing with acute injuries and acute trauma. It's unfortunate that sometimes pain persists beyond the point where it was serving a protective function. People with chronic pain often have persisting pain well beyond the time at which the injury is actually thought to have resolved, but there you are, still having pain years later. And this is thought to be a consequence or associated with central sensitization and peripheral sensitization. So when you're treating the pain of an acute injury, it would be valuable to use topical medications that might work to suppress the inflammation, neuroinflammation in particular, and the central sensitization as well, in an effort to reduce the likelihood of that acute pain from becoming chronic. The good news is we do have multiple medications that are available, and each of these medications have their own independent mechanisms of action, which is great because it means we can use multiple medications pretty much at the same time. And the use of multiple medications can result in something called synergy, in which the whole is greater than the simple sum of the parts. And attacking pain from many different angles through the use of different medications can often provide an optimal way of treating pain. It'll help reduce the reliance on any one medication class, especially opioids. So it shouldn't be forgotten that when choosing a topical medication or multiple medications, to bear in mind the role of synergy and to use multiple medications when it's feasible to do so. So future topics of videos will include specific videos addressing how to treat muscle pain with topical medications. I'll go into the details of which medications may offer the most benefits, as well as the mechanisms associated with muscle pain. I'll do the same with joint pain and with nerve pain and neuropathy pain. In a somewhat different perspective, I'm also going to put together a video that will review prescription medications, including compounded prescription meds, and a video that focuses solely on over-the-counter medications and the confusion that can be generated by looking at branded topical medications that are commercial. Finally, I'll have a separate video that will discuss the role of topical cannabinoids, cannabinoids that include CBD, BCP, and THC, and possibly some others. So thank you for staying here. I look forward to putting out these next few videos and making them available. Thank you.